expert consultations. At Full Circle, we are fantastically educated and experienced in adoption, but one of the degrees we don't have is any medical degree or nursing degree. And so we always recommend that families working with our program have medical experts with whom you can consult about the medical information that we provide to you. We see our role as gathering as much of the available medical information as is possible. And then what we do at the office is we literally have reams of white tape, and we put those over anything that's identifying of the expectant parents, her name, her medical record number, her date of birth, social security number, anything like that that's sensitive. We white all of that out on every single page, scan it in, and then we make purely the medical information available to you for review and discussion with your medical experts. So you might fairly ask, what medical experts should we plan on possibly consulting with? The first would be an OB/GYN, an obstetric gynecologist. It's good to have the kind of doctor who has actually made the record also review the record. The other is we recommend that you have the name of a psychiatrist who feels comfortable not only reviewing psychiatric information, but giving some sense of an estimate of the degree of likelihood that the child would inherit or not inherit that psychiatric condition. We also recommend that you have the name of a geneticist. So, it doesn't come up that often, but every once in a while, we'll have an expectant parent that has a genetic condition, and so we will recommend that you talk with a geneticist about what is the likelihood of the expected child either having that condition or carrying that gene. We also recommend that you have an alcohol drug specialist and a birth defect specialist as somebody with whom you can consult. There are some birth defects that are not genetic per se, like the umbilical cord wraps around a limb or something like that. There can be problems of that sort. It doesn't happen that often. In fact, I can't remember a single case of a birth defect but in one of our cases, but I always want to acknowledge these things can happen. And then in terms of an alcohol drug specialist, in the case of an expectant parent who says, oh yeah, I drank 2 beers each weekend night for the first 3 weeks of the pregnancy, something like that, you would want somebody with whom you could consult and say, okay, what would the risk to the fetus be in such a situation? What is the likelihood of fetal alcohol effects or fetal alcohol syndrome? So ideally, what I would recommend is that you have at least one person in each of these type of specialties available to you for consultation. And I would recommend that you say to them, sometimes we need to have review of records on very close timing. Who would be able to do it from your office if we needed this on a Friday night or over a weekend or at the time of a holiday or when you simply were unavailable for some other reason? And so it's always good to ask them if they have a backup person. And then what you'll do is you'll let Full Circle know that medical expert's name and address, phone number, fax number, and email address. And we keep that on file. And then when there's a potential situation that you would like to review more closely, you will say, yes, I'm still in contact with that particular doctor. Go ahead and send the records to them. And they're completely de-identified records, and expectant parents know that we are sharing them. And then that doctor will consult with you and talk with you about whatever risks there may be. And there's one other thing I'm trying to think about with this. It's very important to see whether the doctors will talk with you about their availability, because it's not unusual for adoption situations to occur, when Mother Nature brings the situation to us and not necessarily on a schedule. So hopefully in conversation, you'll be able to make a decision about whether this is a situation that you feel comfortable with. And if you do, you'll let us know. And if you don't, let us know. We're not going to second guess your judgment at all, but we also appreciate knowing what factors matter to you, because then we can keep that in mind for the future. Thank you.